Undocumented incompetence. That's what Dr. Mercer called it, standing in front of the entire cardiac wing during morning rounds, his voice sharp enough to cut sutures. Elena Martinez absorbed the words the way she'd learned to absorb pain, as information, nothing more. The fluorescent lights hummed their mechanical song above her head. A monitor beeped 3 rooms over. Her hands remained steady as she checked the 4 rate on the post-op patient in front of her, her eyes never leaving the bag of normal saline dripping into the line at exactly 125 milliliters per hour. They didn't know she'd performed field thoracotomies with a combat knife in a desert 11,000 miles away. They didn't know her call sign was whispered in Ramadi firelight by soldiers who'd watched her hold a position for 11 hours against overwhelming force. Elena had been erased so completely from every military database that officially, Captain Elena Martinez had never existed at all. The Pentagon had ordered her to disappear, to fold herself into civilian life as if those years of service, the scars, the weight, the things she'd seen, had happened to someone else entirely. She'd arrived at Cedar Creek Medical in Norfolk 6 months earlier, hired as a registered nurse with credentials that checked every box and raised no flags. The hiring manager had smiled during the interview. "You're overqualified for this position," the woman had said, gesturing to the cardiac care unit. Elena had simply nodded. Overqualified was one word for it. She'd been a trauma surgeon in everything but paperwork, trained to make decisions in milliseconds when decisions meant the difference between a soldier walking or being carried. A hospital's cardiac wing felt like controlled breathing, like watching paint dry compared to what her hands remembered. She moved through Cedar Creek's corridors with the same economy of motion that had kept her alive in combat zones. Every step calculated. Every gesture minimal. Waste no energy. Draw no attention. The other nurses had stopped trying to befriend her by month 3. Elena ate her lunch in the supply room. She finished her charting early. She never complained. She simply worked. What they couldn't see was the tremor in her left hand that only appeared when she was still, the after effect of shrapnel that surgeons had decided to leave in place rather than risk the nerve damage removal would cause. What they couldn't see was the way her eyes tracked exits and entry points automatically, assessing threat angles even in the break room. What they couldn't see was the folded triangle of stars and stripes hidden in her hospital locker wrapped in plastic, the only physical proof that any of her past was real, a flag from a teammate's casket, the one person she'd failed to save, the failure that had ended her career and reshaped her entire life into this, a ghost in scrubs, moving through hallways where nobody knew her name. She touched the plastic-wrapped flag once before her shift started, her fingers pressing against the fabric through the protective layer. A moment of connection to the weight she carried. Then she closed the locker and stepped into the unit. The morning was routine. Blood pressures to check. Medications to verify. A post-op patient in room 443 who was developing some minor arrhythmia patterns, nothing serious, just the heart adjusting to trauma the way hearts do. Elena had noted it on the chart, flagged it for the attending, and moved on. The attending had glanced at her notation, nodded, and moved on too. Dr. Mercer had been in the hallway that moment, watching the interaction with the kind of attention that made her skin tighten. He was always watching. Always calculating. The way a predator calculates distance. By 10:13 a.m., Elena was standing in front of the vending machine on the 3rd floor, feeding a dollar bill into the slot with careful precision. She wanted the black coffee. The one that tasted like it had been brewed sometime during the previous administration but cost only 75 cents. Money was habit now. Waste nothing. Save everything. You never knew when you'd need to move fast. Did you hear her? One of the residents had materialized to her left, a surgical resident named Chen with the kind of confidence that came from never having faced real consequences. The way she said electrocardiogram? Like, maybe it's not pronounced that way where you're from. The second resident, taller, blonder, was already laughing. His name was Torres. Elena had watched him struggle with a basic arterial line insertion 2 weeks ago. She'd been assigned to assist. Her hands itched to take over, but protocol prevented it. So she'd stood there, watching him miss the radial artery 3 times while the patient's oxygen saturation dropped. On the fourth attempt, she'd made a small adjustment to his angle, just the smallest guide of her gloved hand on his wrist. He'd gotten it in. He'd taken the credit. He'd never acknowledged her touch. "She says it like electrocardiogram," Torres mimicked, his vowels exaggerated, his tone dripping with contempt. Elena pressed the button for the black coffee. The machine made its mechanical sound, a groan, a hiss, the cup dropping. The whir of liquid dispensing. She was aware of Dr. Mercer 30 feet away at the nurse's station, his eyes on her through the open doorway. He was watching her reaction. Waiting to see if she would flinch. Waiting to see if she would respond. Waiting to see if she would cry. She retrieved the coffee. It was hot enough to burn her palm slightly. She noted the sensation. Pain was information. She turned to walk back toward the cardiac unit, her eyes meeting neither Chen's nor Torres's. Her face was composed, a mask of professional neutrality that revealed nothing of the 147 ways she could have incapacitated both of them before they hit the floor. Dr. Mercer fell into step beside her as she passed the nurse's station. His shadow was longer than his body, and that's what Elena noticed first, the physical asymmetry of the man, the way he seemed to take up more space than his actual dimensions allowed. That presence made the air pressure change in the corridor, like the atmospheric drop before a storm. "Nurse Martinez." His voice was a blade wrapped in velvet. "I need to speak with you about protocol compliance. In my office. Now." It wasn't a request. It was a command presented in the syntax of politeness, but Elena had been trained to read the difference. She had been trained to read a lot of differences. She set her coffee on the cart beside the nurse's station. She would not get to drink it, and she knew it, and followed him down the hallway toward the administrative offices. His office was sterile. Expensive sterile. A desk of dark wood, a chair that probably cost more than Elena made in a month, photographs of his family in expensive frames. A diploma from Johns Hopkins. Mercer was the kind of physician who had never worked without resources, who had never operated without backup, who had never had to make impossible choices with his own hands. He was competent in the way people were competent when they'd never been tested. Elena recognized the type immediately. "Your performance reviews have been adequate," he began, settling into his chair while Elena remained standing. Protocol dictated she wait for an invitation to sit. She was an expert at protocol. But there have been concerns raised. Multiple concerns. "I'm unaware of any concerns, Doctor." "Then you're unaware of protocol." His eyes were cold, calculated. "Security has flagged several instances where you've accessed patient files outside your assigned patients. That's a violation." Elena's mind moved through the files in question. Room for 47. The Green Beret colonel who'd been admitted post-op 2 days ago. She had accessed his chart 3 times, once to verify his post-operative vital signs, once to check the timeline of his medications, once because her hands had moved on their own. Muscle memory. The body remembering things the mind was ordered to forget. "I reviewed the file to ensure medication compliance," Elena said. Her voice was steady. A tank idling in a garage. The attending's initial notes were incomplete regarding the patient's cardiac history. "That's not your assessment to make." Mercer leaned back in his chair. The leather creaked. "You're a nurse, Nurse Martinez. Not a physician. Not an administrator. Not someone authorized to question a doctor's charting. There are protocols for a reason. The protocols exist to prevent medication errors. Are you really arguing protocol with me?" He smiled then, and it was a shark smile, all teeth, no warmth. "You understand that any further violations will result in immediate termination? That I have documentation of every incident? Security has cameras in the hallways. The system logs every access. I have everything I need to remove you from this facility, effective immediately, should you continue this behavior." Elena could see it now, the way he was building the narrative. The way he was constructing the story he would tell to the administration, the board, the legal team. Undocumented incompetence. Protocol violations. Unauthorized chart access. A pattern of behavior that suggested someone who didn't understand the boundaries of her role. Someone dangerous. Someone who needed to be removed before she caused real damage. What he didn't know was that she could read him the way she'd learned to read insurgent movement patterns, the way she'd learned to predict where violence would erupt before the violence occurred. She could see the fear underneath his arrogance. Fear that someone was looking too closely at things he wanted hidden. Fear that she was a problem that protocol solutions couldn't address. "I understand," Elena said. "Good." He gestured toward the door. The dismissal was absolute. "I expect your full compliance with every hospital policy going forward. Is that clear?" "Perfectly, Doctor." She left his office and returned to the cardiac unit. The coffee was cold now. One of the other nurses had moved it to the sink. Elena made a new cup with the same precision as before. 2:15 p.m. Her shift would end at 7 p.m. The colonel in room for 47 was stable. Vital signs normal. Post-op recovery proceeding according to protocol. She had no way of knowing that in exactly 2 days, the entire hospital would watch her save his life during a cardiac arrest code blue. She had no way of knowing that her hands would remember things the colonel's drugged memory couldn't, that there were older scars binding them together, scars from Ramadi, from a position held for 11 hours, from a teammate who didn't make it home. For now, she simply worked. Steady hands. Quiet dignity. A ghost in scrubs moving through corridors where nobody knew she was a legend. 12 residents lined the conference room walls. For attending physicians occupied the leather chairs. The fluorescent lights cast everything in that particular hospital white that made skin look like drywall. Dr. Mercer stood at the center of the grand rounds table with a patient chart in one hand and Elena positioned directly across from him like a chess piece he'd already decided to sacrifice. "This is Nurse Martinez," he announced, his voice carrying the confidence of a man who'd never been contradicted in his own department. 6 months at Cedar Creek Medical. Previously undocumented employment history. He let that word hang. Undocumented. The residents exchanged glances. Nurse Martinez represents the kind of incompetence we're eliminating from this institution. Her chart notations are inconsistent. Her protocol adherence is questionable. He smiled while saying it, as if they were discussing someone's retirement party instead of her competence. She is precisely the type of nurse we cannot afford. Elena stood motionless. She'd learned this particular skill in Ramadi, the art of absorbing impact without flinching. Breath in. Breath out. The room watched her, waiting for something: anger, tears, a defensive response. 12 residents. For physicians. 20 eyes cataloging her reaction for the story they'd tell later. She felt the pressure building behind her sternum like a second heartbeat, that animal thing inside her that wanted to fight back, to grab his throat and explain exactly what undocumented meant when you'd saved lives in a desert with nothing but muscle memory and morphine and a knife that wasn't meant for surgery. Instead, one tear escaped her left eye. It moved slowly down her cheek. She let it travel the full distance without reaching up to wipe it immediately. The room went silent in that particular way silence does when someone has just cried in front of an authority figure, that held breath silence of professional awkwardness. Elena raised her hand. Wiped the tear. Held his gaze. "My documentation is flawless, Doctor," she said, her voice steady as a trauma bay at 0300 hours when the only thing keeping you upright is muscle memory and the absolute certainty that showing weakness means someone dies. Which is why you've never cited specifics. The residents shifted. One of them, a junior attending named Russo, actually looked like he wanted to applaud. Mercer's smile didn't waver, but something hardened in his eyes, a calculation running behind his expression. He dismissed her with a wave of the chart, turning to the next patient case as if she'd already left the room. Moving on. Myocardial infarction, 67-year-old male, post-intervention arrhythmia. Elena walked out without being told to leave. The hallway stretched in both directions, cream walls and linoleum that needed buffing, the smell of antiseptic so thick it coated your throat. She went to the nurse's station and logged into the patient management system like nothing had happened, like her hands weren't moving on automatic pilot through the ritual of documentation. 2 hours later, the coffee machine in the break room called like a siren. The vending machine area sat adjacent to the second-floor stairwell, a pocket of the hospital where people assumed nobody important was listening. Elena pushed a $1 bill into the slot. Black coffee. No sugar. The machine hummed and dispensed the cup with a mechanical gasp. Did you hear the accent on Martinez? Chen's voice came from the other side of the equipment. A resident. Mid-20s, probably Georgetown undergrad, definitely Georgetown Medical School. I can barely understand her during handoff. Patel laughed. Male voice. Slightly deeper. Maybe that's why her charts are so detailed. She can't actually communicate, so she has to write everything down like a kindergartner. Elena retrieved her coffee. The cup was too hot. Steam rose from the opening. She could feel them watching through the vending machine's metal body, waiting to see if she'd react, if she'd turn around and defend herself, if she'd do something that would give them permission to make this personal instead of just casually vicious. She raised the cup to her lips and walked past them without making eye contact. Her pulse didn't change. Her breathing didn't accelerate. The thing inside her that had kept her alive in Ramadi was very good at teaching her that the moment you acknowledge an insult, you've given the person who delivered it power. She drank the coffee anyway, though it burned her mouth. At 1,447 hours, as she was signing off the cardiac monitoring charts for the afternoon shift, Mercer appeared at the corridor junction with security guard Morrison beside him. Morrison was built like a fireplug and had the intelligence of one, competent at following orders, completely incapable of independent thought. Mercer's positioning was deliberate. He wanted witnesses. Nurse Martinez, he called out, his voice carrying to the entire nurses' station, to the residents passing through, to the 2 visitors waiting by the elevator. If you can't follow proper protocol, we will have security escort you from the building. This is your only warning. Elena turned toward him. She didn't hurry. She didn't perform shame. She simply walked the 15 feet and stopped approximately 2 feet from his position, well outside the space that would be considered confrontational, well within the space where every word he'd said would reverberate between them in the tight air. Which protocol, specifically, Doctor? Her voice was barely above conversational. Quiet people's voices carry differently. They don't fill rooms, they compress them. Mercer's jaw tightened. He hadn't expected that. He'd expected deference or tears or something he could use. Instead, he got a question. A simple, unanswerable question that forced him to either provide details he didn't have or admit that his threat was performance theater. His eye slid away from hers toward room 447, then toward the billing station down the corridor, then toward the storage closet where the supply invoices were kept. That's when Elena understood. The phantom charges appearing on patient bills. The insurance codes that didn't match the procedures performed. The medical supply company, she'd seen the name on invoices, Titan Medical Solutions, every order inflated by approximately 30% beyond market rate. He needed her gone because she had access to the patient records. Because she logged medications and supplies against procedures. Because eventually, if someone competent looked closely enough at the paperwork, they'd see the pattern. The discrepancies. The money that was moving in directions it shouldn't move. He wasn't trying to eliminate her because she was incompetent. He was trying to eliminate her because she was the only person between him and whatever arrangement he'd made with Titan Medical Solutions. Some kind of kickback, probably. Some percentage of that inflated 30% finding its way back to Dr. Mercer in a way that nobody asked too many questions about. We'll discuss this in my office, he said, his voice flatter now, stripped of the earlier theatrical superiority. Tomorrow, 0600 hours. Before your shift begins. He didn't wait for a response. Morrison followed him like a security attachment, and Elena watched them move down the corridor toward the administrative wing, toward the billing office, toward the supply closet. She stood in the center of the hallway with the weight of the afternoon shift pressing down on her shoulders and something else pressing down harder, the absolute, crystalline understanding that she had become inconvenient to a man who had institutional power and very little moral compass. She checked her watch. 1,503 hours. 8 hours until shift change. 4 hours until evening rounds. And in room for 47, a man with a tattoo she recognized was recovering from a code blue that had happened 48 hours earlier, a code blue she'd managed because her hands remembered exactly how to do triage under fire, exactly how to make decisions when there was no time for committee discussions. But that wasn't the worst part. That wasn't even close to the worst part. What happened next changed everything. The alarm shrieked at 2:06 a.m. Code blue, room 447. Elena's feet were moving before her mind caught up, muscle memory from a desert she'd promised never to mention pulling her toward the cardiac wing at a speed that made the tile sing beneath her shoes. The Colonel. She didn't know how she knew. She only knew her hands were already moving, already steady, already home. The room erupted into controlled chaos. 2 residents froze like they'd been painted there. A respiratory therapist scrambled for the ventilator cart. The Colonel lay sprawled across the bed, his massive frame a monument to stillness, his chest refusing to rise. Asystole. Flat line. The monitor sang its dead song, a single unwavering line that meant the heart had stopped negotiating with life. Elena was already at his bedside, gloved hands pressing into his sternum. The compressions were perfect, mechanical, the kind of perfect that came from having done this with a man bleeding out into desert sand with nothing but moonlight and the weight of survival between them. Push hard. Push fast. The ribs shifted beneath her palms like the work of demolition, like building something new by breaking down what had failed. "Get me a crash cart," she said. Not a request. A command. The voice that came out of her was not the voice of the nurse they'd seen swallow insults at the vending machine. This was a different voice entirely. This was Captain Martinez. This was the voice that had held a position in Ramadi for 11 hours against overwhelming force. This was the voice that didn't ask. It ordered. And people obeyed. Dr. Mercer arrived with his stethoscope still hanging from his neck like a decoration, eyes widening as he took in the scene. Elena had not stopped compressions. 2 minutes of chest compression without ROSC, without return of spontaneous circulation, and the textbook answer was time of death. Elena had never learned to read textbooks. She'd learned to read bodies the way soldiers read terrain, for hidden paths, for possibilities that couldn't exist but had to. How long? Mercer asked, moving toward her as if he owned the moment. 90 seconds, she said. Asystole. Initial rhythm. The crash cart arrived. Someone, a resident whose name Elena had forgotten because she'd never bothered to learn it, pushed the defibrillator pads onto the Colonel's chest. 200 joules. The body arched. The monitor showed nothing. Still flat. Still dead. Elena didn't slow her compressions. The others watched as if she were conducting an orchestra only she could hear. Another round of epinephrine, 1 milligram for push, the syringe disappearing into the line like blood into sand. Another shock. 240 joules this time. The body moved. The monitor showed nothing. "Call it," Mercer said. His hand was on her shoulder, and he was squeezing like he was squeezing out her authority along with the muscle. "Elena, it's been 4 minutes. We need to call it." She didn't stop. She couldn't stop. The muscle memory wasn't just memory anymore, it was prophecy. She knew this body. Not from charts or from the 6 months she'd worked at Cedar Creek. She knew him from blood and from night, from hands pulling him toward extraction when every tactical calculation said leave him, when every survival metric said he was already gone. She'd carried him before. She could carry him again. "One more round," she said. Not asking. The compressions continued, harder now, deeper, the kind of violence that was indistinguishable from love. The monitor watched. The assembled residents watched. Mercer's hand slipped from her shoulder. The monitor jumped. P-wave. Narrow complex. Sinus rhythm. 1 beat. 2 beats. 3 beats. That meant the heart had remembered its job, that it had come back from the dead the way some people do when someone refuses to let them stay there. "We have a rhythm," someone whispered. Elena stepped back. Her hands were shaking, not from fear, but from the raw kinetic energy of a body that had learned to hold still in the worst moments and now couldn't quite remember how. She shoved them into her pockets. The trembling wasn't fear. It was restraint. It was the physical manifestation of every instruction she'd ever been given about keeping secrets. Dr. Mercer moved in, suddenly competent, suddenly present, his stethoscope finally earning its place around his neck as he listened to a heart that Elena had massaged back into rhythm with her bare hands while stunned residents stood frozen like monuments to their own inadequacy. The colonel's blood pressure was climbing. Weak, but climbing. 60 over 40. 70 over 50. The numbers that meant life was insisting on itself. "Good work," Mercer said to the assembled room. His eye skated past Elena like she was furniture. Like she was nothing. Like she hadn't just reached into a dead man's chest and pulled him back. "Let's get him to ICU. Full monitoring. I want labs every 4 hours." The nurses moved. The residents scattered. The crash cart was wheeled out, leaving Elena alone in room 447 with the memory of a man she couldn't acknowledge that she knew. The colonel's eyes were closed. The ventilator wheezed its mechanical rhythm, a sound like something broken learning how to breathe again. His right arm lay across his ribs, and there, just visible above the hospital gown's fabric, was skin marked with ink. A tattoo. Elena's breath caught, one moment of visible reaction before she locked it down, buried it, made her face into the smooth surface of a still pond. Valkyrie. Her call sign. The name they'd used in the desert when they'd called her to extraction zones and she'd come without hesitation. The name they'd buried along with her official record when the classified operation was sealed and she was told to disappear into civilian life as if those years had never existed. As if she had never existed. As if the person she was before the hospital, before Norfolk, before the forgetting, was just a story told by someone else. She turned away from the tattoo. She had to turn away. The alternative was staying in that room and falling into a past that had no official shape anymore, that lived only in sealed files and military databases where her name had been erased, where Captain Elena Martinez was just a ghost story told to recruits about what happened when you refused to abandon people behind enemy lines. By 6:15 a.m., the morning shift was filtering in. Nurses clocking in, residents reviewing charts, the hospital breathing like it always did at dawn, the shift change where night became day and the secrets of darkness had to accommodate themselves to fluorescent illumination. Elena had showered in the staff bathroom, had changed into fresh scrubs, had composed the mask that hid everything that wasn't allowed to exist. Her assignment change was waiting in her locker like a termination notice disguised as a transfer. A handwritten note from Kim Santos, the day shift supervisor, her voice apologetic even in silence. "Elena, Mercer's orders. You're transferred to pediatric wing effective this shift. He said you need broader experience. Let's talk later." Broader experience. Translation, away from cardiac care. Translation, away from room 447. Translation, isolation. Elena folded the note once and placed it in her locker beside the folded triangle of stars and stripes she'd carried for 8 years, the flag from her fallen teammate's casket, the only physical proof that any of it had been real. The flag whose name she'd never spoken aloud, whose service had been redacted so thoroughly that even the official records pretended he'd never drawn breath. She moved her supplies to the pediatric wing. 146 steps from the cardiac unit to the opposite end of the hospital, each step a separation, each corridor a distance that was becoming something permanent. The pediatric ward smelled different, gentler, like the antiseptic had been diluted with hope. Children slept in rooms painted with cartoon whales and clouds. Monitors beeped at gentler intervals. The world here was smaller, softer, a place where the worst thing that could happen wasn't usually fatal. It was the quietest rotation. Elena had noticed the pattern by the second shift, Tuesday nights at 11 p.m., Wednesday mornings at 6 a.m., Friday afternoons when the senior staff was in departmental meetings and no one who mattered was around to witness anything. The schedule wasn't accidental. It was architecture. It was the careful construction of isolation. Dr. Mercer stood behind his glass office wall on the third day, speaking into his phone with a hand gesturing like he was molding air into compliance. Elena passed close enough to catch fragments. Medication discrepancy. Board review. Documentation issues. His smile was the smile of a man who'd learned to weaponize bureaucracy, who understood that a person could be erased not with violence but with paperwork, with the slow accumulation of false records that would eventually become truth through repetition. She'd seen it before. In Ramadi, the insurgent networks had used the same technique, create a false narrative through enough official channels, and eventually no one could distinguish the lie from the classified operation anymore. She'd watched it happen then. She was watching it happen now. That evening, she was at the billing station checking pediatric discharge summaries when she saw it. Invoice for room 447. Surgical supplies from a vendor called MedSource Supply Solutions. 14 units of 14-gauge angiocath needles. The code was right. The quantity was wrong. Standard protocol for a code was 4, maybe 5. 14 was the kind of inventory that existed only on paper, the ghost supplies that got paid for but never used, the inflation that turned a legitimate emergency into a billing opportunity. She photographed nothing. She said nothing. Her hands tightened on the chart like she was holding something that might escape if she loosened her grip. At 7:48 p.m., Dr. Mercer intercepted her at the locker room entrance. HR Director Walsh stood beside him, her face arranged into an expression of professional concern that couldn't quite hide her discomfort. Elena knew the look. She'd seen it on officers' faces when they were about to deliver orders they didn't believe in. Elena Martinez, we need to discuss a serious medication discrepancy from last night's code, Mercer said. His voice was the voice of administration, of power, of a man who'd learned that hospitals had more ways to destroy people and medicine had ways to heal them. A controlled substance count that doesn't match your documentation. I documented everything in real time in the electronic system, Elena said. Her voice was quiet. Compliant. Small. She was good at small now. She'd had 6 months to master it. You can cross-reference the timestamp. We'll need to investigate, Walsh said. Her fingers were twisted together. You're suspended pending review. Mercer's smile was surgical. We take medication discrepancies very seriously, Elena. Very seriously indeed. Elena nodded once. She didn't argue. She didn't defend herself with the truth, because the truth had no jurisdiction here. The truth belonged to classified databases and sealed military files and a past that had been officially buried. The truth was that Captain Elena Martinez had spent 11 hours holding a position in Ramadi without backup, without reinforcement, without permission to leave, and had survived by refusing to accept that survival was negotiable. But that Elena Martinez didn't exist anymore. That Elena Martinez was a ghost. And ghosts couldn't testify at board reviews. She turned in her scrubs in the laundry that night, folding the blue cotton one final time with the same careful precision she'd once used to fold a flag from a fallen teammate's casket. The cotton was soft from repeated washing. The flag was soft from 8 years of being held. Both felt like the last evidence that anything had ever been real. She was returning her badge to security when her phone rang. Unknown number. Military prefix. She answered without thinking, the muscle memory still running deeper than caution. Captain Martinez. A voice like a tank idling in a garage. We need to talk about room 447. Nurse Supervisor Kim found Elena at the medication dispensary at 2:27 p.m., her badge clipped to the pocket of her scrubs, her movements efficient and unremarkable. The kind of presence that dissolved into the background. Kim's jaw was tight. Her eyes wouldn't quite meet Elena's. We need to talk about your assignment, Kim said quietly, glancing left and right down the corridor. The fluorescent lights cast everything in a pale institutional wash. Administration has made a decision regarding your position in cardiac care. Elena continued scanning vials. Her hands didn't pause. I'm listening. You're being reassigned effective immediately. Pediatric wing, nights. Starting tonight. Kim's voice carried the careful neutrality of someone reading bad news from a script she hadn't written. There's also a medication discrepancy that surfaced in your records. From 2 weeks ago. The chart audit flagged an unauthorized access to room 447 on the evening of. I was asked to check the colonel's potassium levels, Elena said. Her voice remained level. The cardiologist requested a follow-up before his morning EKG. The request isn't in the system. Kim's shoulders tensed slightly. This was difficult for her. Elena could see it in the way she held her breath between sentences. Administration has reviewed the documentation. There's no order on file. Which means either the order was never logged, or you accessed his chart without authorization. The silence stretched between them like a rubber band pulled taut. Around them, Cedar Creek Medical continued its rhythmic pulse, pages echoing over the intercom, the distant sound of a monitor alarming 3 rooms down, a crash cart rattling past toward the elevators. What happens next? Elena asked. You work the pediatric assignment tonight and tomorrow night. That's your last shift. After that, you're on suspension pending a formal review. Kim's voice dropped. Elena, I know this doesn't feel right. But my hands are tied. These came from Dr. Mercer directly to Hospital Administrator Walsh. I can't override that level of escalation. Elena closed the medication dispensary and turned to face Kim fully. For a moment, neither woman spoke. Kim's discomfort was visible now, the small flinch, the way she braced for a reaction that never came. Elena simply nodded, a single measured acknowledgement. I understand, Elena said. I'll work the pediatric wing as scheduled. That was the final thing she said to Kim. The supervisor left the medication room with visible relief, the kind of relief people carried when they delivered bad news to someone who didn't fight back, didn't cry, didn't make it worse. Elena returned to the dispensary. Her hands resumed their work with the same precision they'd maintained that morning as she'd performed a thoracotomy in the cardiac wing, the same precision that had held steady in Ramadi when the insurgent fire came in waves and the aid station became a surgical theater under open sky. She worked the pediatric shift that night with the same attention she'd given every patient since arriving at Cedar Creek 6 months ago. A 4-year-old with acute appendicitis, prepped for surgery at 7:15 p.m. Elena moved through the preparation with the efficiency of someone who'd learned long ago that every second mattered. She started the 4 line on the first attempt, a skill earned through thousands of insertions, though most of them had been under conditions that pediatric nurses would never face. She documented vitals with flawless precision. She answered call lights. She sat with a 6-year-old who was terrified of the operating room and spoke to him in a voice that carried absolute certainty, "You're going to be fine. The surgeons are very good at what they do." She meant it. She had no doubt about it. At 11:23 p.m., while Elena was charting in the pediatric wing, the overhead intercom crackled, "Code blue, cardiac ICU, room for 47. Code blue, cardiac ICU, room for 47. The words hit like a physical blow. Room for 47. The colonel. His heart failing again, his body rejecting the standard rhythms of survival. Elena's hand stopped moving. Around her, the night shift nurses looked at each other with the particular concern reserved for codes called in the middle of the night when skeleton crews meant every available set of hands mattered. She was not assigned to cardiac care anymore. That floor was not her assignment. That patient was not her problem. Elena finished typing her final note and stood. She walked toward the stairwell. Her badge swayed against her ribs with each step. The sound of her shoes on the tile was the only noise she made. The cardiac ICU was controlled chaos when she arrived. The code team had been running for 90 seconds. Dr. Mercer had not yet arrived. Resident Patel stood at the head of the bed with a bag valve mask, squeezing oxygen into the colonel's lungs with mechanical repetition. 2 nurses circled the bed, 1 compressions, 1 medication push. The colonel's naked chest showed only the pale scar from Elena's incision 2 days prior. His heart had decided that survival was optional. How long? Elena asked, moving to the crash cart. 90 seconds. Lost sinus rhythm at 11:21. No response to initial epi, Resident Patel answered. He glanced at her with the particular relief of someone seeing backup arrive. We've got 2 more rounds of. I need a thoracotomy tray. Elena's voice had dropped an octave. It was no longer the voice of the quiet nurse from the medication room. Open cardiac massage. Now. He's already had one 2 days ago, Resident Patel said. Protocol says we wait for Dr. Mercer to. He'll be 10 minutes out, Elena said flatly. Colonel Davis will be dead in 3. She was already opening the crash cart, her hands moving with the terrifying fluid precision of muscle memory. Call for the thoracotomy tray and 2 units O negative. Call CT surgery. Now. No one moved. The room hung in that particular silence of people watching someone take command in circumstances that had no clear hierarchy. The nurse doing chest compressions paused, looking at the resident, looking at Elena, uncertain which voice carried authority. I said now, Elena repeated. Her voice carried the weight of a woman who had held lives together with her bare hands in an aid station while insurgent fire tracked the sky above her. Suddenly the room moved. Someone ran for the tray. Someone was on the phone. Someone was pushing medication. Elena pulled on sterile gloves with the kind of smooth efficiency that took years to develop. Her fingers found the landmarks on the colonel's ribs, the 5th intercostal space, the mid-axillary line. She marked it with a scalpel and cut. The blade went through skin and muscle in one smooth motion. The smell of blood rose up, metallic and immediate. She took the rib spreaders and opened his chest cavity with a crack that echoed off the ICU walls. Everything below the ribs lay exposed, visceral and real. His heart was barely moving. She found it, a fist-sized organ beating with the desperation of something dying, and cupped it in her palm. She began massaging it manually, rhythmically, her forearm moving with the precision of someone who had done this in conditions far worse than a climate-controlled hospital room. Outside of Ramadi had been desert heat and uncertainty. This was certainty. This was knowledge. Her hands moved on their own because they had always known how to do this. The monitor showed electrical chaos. Then, beneath her palms, a flutter. A hesitation. A rhythm reasserting itself. The colonel's heart began to beat. Resident Patel stared. The nurse doing compressions froze. The attending who had been reaching for the phone lowered it slowly. Elena kept massaging, kept the rhythm going, her hands covered to the elbows in blood. 2 units O negative wide open, she said without looking up. Keep his pressure above 70. Get me a temporary dressing for this closure, I want it sealed in the next 90 seconds. By 11:06 p.m., Colonel Davis had a pulse. By midnight, Elena had closed the temporary dressing over his cracked ribs with the kind of meticulous care that suggested this was simply another task in a shift that had started in the morning like any other. She stepped back from the bed, and that was when Dr. Mercer arrived, his hair still rumpled from sleep, his coat buttoned incorrectly. He took in the open thoracotomy, the blood on Elena's arms, the monitor showing a barely stable heart rhythm, and his face went white. Then red. Then the color of someone watching their entire strategy collapse in real time. He looked at Elena. She was already disposing of her gloves, her movements unhurried, her composure absolute. Get that dressing stable and get him to CT, she said quietly to Resident Patel. His pressure's climbing, but he needs imaging to assess the integrity of his organs. Don't wait for him to deteriorate. She walked out of the cardiac ICU at 12:07 a.m. No one stopped her. No one spoke. At 6:36 a.m., Elena returned her scrubs to the hospital laundry. The early morning had turned the sky a pale gray. Rain hammered the loading dock outside the window, not gentle rain, but the kind that came in sheets, that demanded respect. She held the blue cotton scrubs in her hands, fabric still carrying the warmth of her body, and folded them with the same precision she had once used to fold the flag from her fallen teammate's casket. That flag had been presented to his mother at Arlington. Elena had kept a triangle of it hidden, a scrap of stars and stripes that had become the only physical proof that her years in Ramadi had been real. The laundry worker didn't look up from his machine. Elena set the scrubs on the counter and turned toward her locker. She had exactly 3 possessions left in Cedar Creek Medical: her jacket, her personal items, and the triangle of flag folded against the metal back. She opened locker 247. The flag lay exactly where she'd left it, pressed between her spare shoes and the stitched unit patch she'd never quite been able to throw away. The stars were faded. The creases were permanent. When she unfolded it, it barely held its shape anymore, as if it had forgotten how to be whole. She held it in her hands. The rain continued outside. Somewhere in the hospital, Colonel Davis was being wheeled to CT imaging, his newly restarted heart pushing blood through vessels that Elena's hands had massaged back to life. Somewhere, Administrator Walsh was reviewing the paperwork on her termination. Somewhere, Dr. Mercer was calculating his next move, unaware that his timeline had just been irrevocably changed by a woman he'd been trying to erase. Elena folded the flag one more time. Then she placed it in her jacket pocket, close enough to feel like something real, and walked toward the parking lot where the rain was still falling like applause. That evening, before Elena could reach her car, the ER doors burst open like a gunshot. Police escort. Sirens cutting through the rain. A man on a stretcher, torso wrapped in trauma dressings that were already bleeding through, and handcuffs attached to the gurney rail. Hostile detainee classification. The ER erupted into controlled chaos, trauma surgeons moving with the terrifying fluid precision of apex predators, nurses calling out vitals like a metronome counting down time itself. Elena was supposed to be gone. Her final paycheck was in her pocket. But her feet didn't move toward the exit. They moved toward the sound of the code, toward the familiar rhythm of death announcing its arrival. She stood at the edge of the trauma bay, watching. Hands clasped in front of her like a mourner at a funeral. The detainee was semi-conscious, blood loss at a rate that meant maybe 4 minutes until cardiac arrest. Maybe less. The surgeons were already discussing emergency thoracotomy, calling for equipment, and Elena could see the hesitation in their movements, the delay that came from doctors who'd practiced the procedure in simulations but never felt a human heart stop beating in their bare hands. That was when the man on the stretcher turned his head. His eyes moved across the bay. Found her. Locked onto her like a missile finding its target. His lips formed a single word. Barely audible. Barely a breath. Valkyrie. The room didn't go silent. The monitors kept beeping. The ventilators kept wheeling. But Elena felt it anyway, that specific gravity shift when the earth tilts beneath your feet and nothing settles the same way again. She stepped forward. The trauma surgeon, a man named Brennan who'd never seen her do anything except change bedpans, said, we need to move now. Elena was already there. Hands moving like someone who'd done this in the desert with a combat knife and morphine running low. 11 blade. Size 36 French chest tube. Let me. She didn't ask. She didn't wait. Muscle memory took over, and her hands moved with the terrifying precision of someone who'd spent 11 hours holding a position in Ramadi with ammunition running out and no backup coming. The surgeon stepped back. He didn't argue. The needle went in. The hiss of air escaping. The man's oxygen saturation climbed. 68, 72, 79, stable. Elena's jaw was clenched so tight she could taste copper, but her voice was level. He's going to need blood. O negative if you have it. 2 units to start. She turned to the nurse next to her. Warm him up. Core temps dropping. Bear hugger. Now. She looked at the detainee's face, the scar tissue under his left eye, the break in his nose that had never healed straight, the beard that was longer than military regulations but shorter than insurgent custom. She knew him. Knew his voice. Knew the radio calls and the firefight coordinates and the reason he was supposed to be dead. That was when the door opened again, and this time it wasn't police. It was dress blues. Captain insignia. Marine Corps liaison officer with a face like someone who'd just walked out of a classified briefing. He moved directly to Elena, his eyes never leaving hers, and in his hand was a file, the kind that came from databases that technically didn't exist. He opened it without ceremony. Without hesitation. Captain Elena Martinez. 12 years of active service. 3 tours in the Middle East. Combat medical badge. Army Commendation Medal with Valor device. He turned the page. Bronze Star. The trauma surgeon had gone pale. The nurses had stopped moving. Silver Star. Elena's breath didn't change. Her hand stayed steady. 2 purple hearts. The liaison's voice didn't waver. And a Navy Cross. He looked up from the file. For actions during Operation Enduring Freedom, Ramadi District, November 2011. You held a defensive position for 11 consecutive hours against overwhelming insurgent force, treating casualties under fire, refusing evacuation orders until all personnel were extracted or accounted for. Your service was classified. It was buried. You were ordered to disappear. He closed the file. That order no longer stands. The doors opened one final time, and a general walked in, 2-star, Navy, with the kind of presence that made the air pressure change. She looked at Elena for exactly 3 seconds, then saluted. A full military salute, fist to chest, the kind reserved for soldiers who'd earned it with blood and bone. Elena didn't return it. She was holding a chest tube that was keeping a man alive, keeping the man whose face she'd never forgotten, the man whose call sign she'd carried across 8 years of civilian life, the man whose presence meant her past wasn't dead after all. That was when Dr. Mercer appeared in the doorway. His smug expression had calcified into something harder, something that looked almost victorious, like he'd been proven right about Elena overstepping, exceeding her authority, performing procedures she had no business attempting. His mouth opened. This patient requires authorized, but before he could finish, before he could assert dominion over this moment the way he'd asserted it over every moment in this building, the ER doors opened again. Not for emergency. For arrest. 2 FBI agents, credentials displayed like playing cards on a poker table. The lead agent, a woman with silver hair and eyes that had seen every lie the human face could manufacture, stepped toward Mercer directly. Dr. Richard Mercer? You're under arrest for healthcare fraud, insurance fraud, and falsifying federal medical records. Mercer's face drained of color like someone had opened a valve. There's been a mistake. I'm the chief of cardiology at this institution. The senior agent, Morrison, didn't let him finish. She was already reading her litany. When you fabricated documentation to justify terminating Ms. Martinez, you created records that contradicted her sealed military file. Those records entered federal databases. That triggered automatic alerts in 3 separate agencies, FBI, NCIS, and Defense Intelligence. The handcuffs appeared. Bright metal catching the overhead lights like something surgical. The forged medication discrepancy. The altered personnel file. The false disciplinary documentation. All evidence. All now in our possession. And your phone records show you calling hospital board members asking them to overlook irregularities and fast-track her removal before she discovered your billing arrangement with MedSource Supply Solutions. Mercer was being read his rights now, his wrists cuffed, the words washing over him like contamination he couldn't scrub away. The agent's perp walked him toward the door, and as they moved, he passed the vending machines where he'd orchestrated Elena's humiliation 2 days ago, where he'd stood with her trauma shears and her dedication and his contempt. He passed the nurse's station where he'd threatened her with security escorts. He passed Residents Chen and Patel, who'd mocked her accent, who'd learned in that moment that the quiet woman they'd dismissed had just saved a life in front of a general and the FBI. Hospital security was already seizing his office. The forensic accountant had already pulled the contracts, 30% inflation on every MedSource invoice, phantom charges appearing on patient bills, insurance codes that didn't match procedures performed. The conspiracy to commit fraud against 847 patients across 3 hospitals. The kickback arrangement that had net him approximately $340,000 over 18 months. 6 months later, in a community college gymnasium in Norfolk, Dr. Richard Mercer stood in front of 32 CPR certification candidates, demonstrating chest compressions on a rubber torso that would never bleed, never arrest, never require the kind of competence he'd spent his career faking. His hourly wage was $16.50. His medical license hung in a legal evidence box at the FBI field office, gathering dust like an artifact from a life that no longer belonged to him. The trial was set for spring. 3 hospitals. 17 physicians. The investigation into kickback schemes had expanded to 7 states. None of that mattered when Elena stood in room 447, her hands in the pockets of new blue scrubs that bore the title Trauma Coordinator embroidered in white thread. Colonel James Davis was sitting upright now, his surgical wounds healing clean, his color returning like someone was slowly turning up the volume on his life. His fingers were tracing the tattoo on his arm, the coordinates, the date, the call sign inked there by a Marine in Kandahar who'd been drunk enough to ask him what it meant and sober enough never to ask again. "I remember now," the colonel said. His voice was rough from the breathing tube, but it was steady. The morphine kept it buried for so long. "But you were there. You carried me 300 meters to the extraction point. You wouldn't leave me behind. You wouldn't even when the building was coming down." Elena felt her chest tighten, felt the weight of 8 years pressing down like an anchor, felt the specific ache of a secret that had consumed every breath she'd taken since that day. She reached into her jacket pocket and withdrew the triangle, stars and stripes folded into the ceremonial shape, the fabric worn soft from 8 years of her hands touching it during the hours she couldn't sleep, the hours she was supposed to be someone else, the hours she was supposed to forget. She unfolded it carefully. Let him touch the fabric. His fingers traced the folds like a blind man reading Braille, like he was translating something written in a language only soldiers understood. Elena's voice, when she spoke, sounded like it was coming from underwater. From some deep place where the truth had been drowning all this time. This was for Sergeant Michael Chen. He didn't make it to the extraction point. You and I both tried. We were 11 hours in. Ammunition had been redistributed 3 times. He took a round through the abdomen, and the blood loss was catastrophic, and I made the choice to help you instead of him because you had a wife and 3 children in San Diego, and he was single, and it was the worst mathematics I've ever performed in my life. She sat down on the edge of his bed. Kept the flag between them like a prayer book. The military buried the operation. Called it a classified success and erased the casualty from every record. Ordered me to disappear. Told me never to surface, never to speak, never to let anyone know Captain Elena Martinez had ever existed. I became just Elena. Just a nurse. Just someone pushing buttons on machines and taking orders from doctors who thought incompetence came with an accent. She looked at him. I saved your life twice. Once in Ramadi. Once here, 2 days ago. And I would do it again, Colonel. I would do it every single day for the rest of my life, because the only thing worse than losing you both would be losing you and never getting the chance to try again. Davis was silent for a long time. Then he sat up straighter, his surgical wounds pulling tight, and raised his hand in salute. Full military salute. Fist to chest. The same salute the general had given her in the trauma bay. But Elena shook her head. Slowly. Like someone saying no to a question that had been asked of her for 8 years. I'm not Captain Martinez anymore, Colonel. I'm just Elena. I'm just a woman who happens to remember how to save lives and happens to never forget the ones I couldn't save. Davis lowered his hand. Kept looking at her with eyes that finally recognized the person looking back. You saved my life twice, Elena. That makes you captain forever. Cedar Creek Medical offered her reinstatement with a formal apology, full back pay dating to her termination, and a promotion to trauma coordinator with authority over training protocol across all emergency departments. She accepted on one condition: the folded flag got a place in the staff lounge memorial case, beside a bronze plaque with Sergeant Michael Chen's name and the truth about where it came from. On her first day back, a junior resident approached her at the coffee station and asked, carefully, respectfully, how she'd stayed so calm during Dr. Mercer's attacks, how she'd never responded to his contempt with anger or frustration or anything that revealed the strength underneath. Elena adjusted her scrubs and looked at the young doctor with eyes that had held the worst and emerged intact. The quietest person in the room might be holding it all together, she said. You just can't always see it until everything falls apart. She walked toward the cardiac wing, her hands steady as they'd always been, her past no longer buried. Her phone buzzed once, a text from Colonel Davis: "Thank you for Sergeant Chen. Thank you for staying." She didn't respond with words. She just put her hand over her heart and held it there, feeling the weight of 8 years finally starting to lift, feeling the possibility of a life that didn't require disappearing, feeling, for the first time since Ramadi, like Captain Elena Martinez was allowed to exist. If this story moved you, if the idea of someone carrying the weight of an entire other life, sacrificing recognition for the sake of security, resonates with the person you are, please subscribe for more stories about the quiet heroes who hold everything together. Like this video. Share it with someone who might need to remember that true strength doesn't announce itself. Comment below: have you ever been underestimated by someone who didn't know your true value?